Welcome to the Pediatric Intensive Care Unit. The PICU consists of two sides, blue and gold, and a silver resource team. Each side has 24 beds for a total of 48 in the unit. The PICU is staffed differently in the morning and at night. Attendings oversee care for the entire unit. Fellows are in charge of a single side of the unit, or about 14 to 16 patients, blue or gold. Residents observe and learn from the fellows and attendings while assisting in patient care. Advanced practice nurses, or APNs, assist in providing care on one team. The patient care facilitator, or PCF, also called charge nurse, manages the nursing staff as well as admissions. Resource nurses assist the bedside nurses across the unit. Bedside nurses, or BSNs, are in charge of moment-by-moment care for 1 to 2 patients. Respiratory therapists, or RTs, care for the respiratory needs of 8 to 12 patients. Primary care assistants, or PCAs, directly care for the well-being of patients. There are also pharmacists and dietitians. In this video, we will go over both scheduled and emergent events on the PICU floor. This includes handoff, rounds, summary, and huddle, as well as different types of admissions and emergency response procedures for deteriorating patients. This is a glimpse into a typical day in the PICU. Between 6 and 7 in the morning, everyone starts their day with the handoff. During this crucial exchange, the previous shift updates the next shift team on all the patients and any pertinent information. Following the handoff, each team embarks on their morning rounds. These discussions provide detailed patient updates and formulate a comprehensive care plan for the day. This ensures that every team member is informed and aware of their responsibilities. After rounds conclude, the healthcare providers gather for a brief 10 to 15-minute session to summarize key points. They run through the patient list once more to ensure nothing is overlooked. Additional teaching for the residents occurs at this time. The rest of the unit continues with their daily routines and patient care. Following this, the PCF leads a huddle session with representatives from each team. During this session, patient staffing and flow is reviewed, followed by updates and a summary of patient status and plan. High-risk or watcher patients are also reviewed at this time. After the huddle concludes, all team members resume their assigned duties, focusing on patient care. They continue to update and share information with each other, address patient care-related questions, and provide assistance in different events. Admissions happen regularly in the PICU, whether they are scheduled or non-scheduled. It begins when the charge nurse and CCOT team receive a house-wide pager alert notifying them of the admission. The charge nurse assigns and notifies the bedside nurse about the new admission and to prepare the room for their arrival. The patient is brought to their assigned room in the PICU. The PICU lead fellow receives a handoff from the surgical team provider on the patient's status. In the meantime, the nursing team connects the patient to necessary bedside settings, such as IV, monitors, and ventilators as needed. The PICU fellow assesses the patient's condition and addresses their immediate health needs. They then provide a care plan for the patient and complete any necessary documentation or bundles required for the patient's needs. The PICU fellow discusses the plan of care with the bedside nurse and the bedside respiratory therapist, determining their current status and their health goals. Once the team successfully admits the patient, all the roles will carry on with their assigned tasks. There are various emergent events that may occur daily. Here, we illustrate how the PICU team adeptly manages unforeseen circumstances without disrupting their routine tasks. The bedside nurse notices a decline in patient vitals and presses the code blue alarm button. The PICU team rushes to the room, responding to the code blue. The bedside nurse updates the code team leader, usually the fellow. The charge nurse controls the amount of personnel in the room. The RT begins to manually ventilate the patient. The code team leader is assisted by the attending to update the team and share the mental model, as the charge nurse continues to manage the responding personnel from outside the room. The nurse practitioner, as the CPR coach, manages the defibrillator to identify shockable rhythms and provide CPR feedback to the compressors, who are performing chest compressions on the patient. The code team leader assists with rhythm identification, drug administration, and additional orders to help determine the cause of the cardiac arrest. If the cardiac arrest continues, eCPR is activated by the PICU attending while high-quality CPR continues. The charge nurse calls the ECMO and surgery teams to come to the bedside. The code team leader informs the team that the surgery team is on their way, and it is time to prepare the room. As room preparation begins, the nurses and respiratory therapists ensure there are no accidental disconnections as CPR continues. The team rotates the bed into place for the surgery team to have proper access. The surgery team arrives and gets in place at the head of the bed. As the ECMO team arrives, they set up the ECMO pump system on the right side of the bed. The pharmacy team hands off the ECMO medication to the team. The resource or charge nurse directs the team preparing for a sterile environment as the crash cart moves in. The ECMO team continues to set up their equipment, and the surgery team finishes preparations and begins the procedure. The surgery team coordinates with the code team leader and CPR coach to pause compressions for short intervals for the placement of the cannulas. The surgery team communicates when the cannulas are in position and ready to connect to the ECMO circuit. At the surgeon's direction, the ECMO team activates the ECMO. At 4:00 p.m., handoffs are conducted by the healthcare providers to swiftly update and transition care to the evening team. Meanwhile, the rest of the unit attends to patient care. Following the provider's afternoon handoff, the nursing staff conducts their own handoff, assigning roles for the evening shift. Meanwhile, the providers continue patient care and the admission and discharge of patients. They maintain communication with other team members, exchange information, address queries related to patient care, and offer assistance as needed throughout the shift. One APN remains on duty, while the rest of the silver or resource team will depart. Between 9 and 10 p.m., the blue and gold teams begin their evening rounds, providing brief patient updates and formulating a comprehensive care plan for the night ahead. This ensures that every team member is fully informed and aware of their responsibilities through the night. These rounds may be shifted earlier or later based on patient care needs. The PCF leads a huddle session with representatives from each team. During this, teams will provide updates and summarize the status and plan of their patients. After the huddle concludes, all team members resume their assigned duties, focusing on patient care. They continue to update and share information with each other, address patient care-related questions, and provide assistance in any required situations.